So we're going to give them just a second. Hello, everyone. We're just waiting for everyone else to be able to join for just a moment, and then we'll get us started. Awesome. Looks like we're almost all joined. I'm going to make Kristen co-host so she can help me add people in if that's okay, if she's there. All right, looks like everyone is joined. Perfect. I'll start my video so everyone can see me too. So hello and welcome everyone. It is, what is it? It's 11 o'clock Eastern, 9 o'clock Mountain Time, and we're ready to get started with our second session. My name is Ty Aller, and I'm actually located here at Utah State University, and I'm a part of the MHDD, or the Mental Health and Developmental Disabilities National Training Center, as well as part of AUCD's Mental Health Special Interest Group's leadership team. We're really excited to have you join us today for our second session of the 2021 Mental Health Summit, online discussions on the intersection of mental health and developmental disabilities. Prior to introducing our great speakers today, I wanted to just briefly provide y'all with a bit of Zoom etiquette before our speakers present. I'm going to be moderating the Zoom room today, and it looks like my colleague Kristen Dahl will be here too. So if you have questions, feel free to shoot them to myself. And if I don't respond promptly because I might be running a couple of other things, you can also probably send a message to Kristen. She's a co-host, so she might be able to help as well. Before that, we'll just go over the basic Zoom etiquette, which we're probably all used to due to the world moving to these online formats. So the controls we'll be using throughout the day are all located on the bottom bar of your Zoom window. First, we'll be using the chat box, and I think Verity and Lauren have actually made this a very interactive presentation, and they want your interaction, if I remember right. So please send your questions in there. We do have a little bit of time at the end to try to address those. In my experience, there are often way more questions than we have time for though, so we'll do our very best to try to get to them all, but we'll likely have to be selective. So we'll give us contact info at the end if we want to continue some of these conversations. Everyone should be muted at this time, and we've actually asked people to mute themselves. But I think, and Verity, you guys can correct me if I'm wrong, but you're okay with everyone's cameras being on so you can see faces as you go. Is that correct? Yeah.
Yeah, absolutely.
We're trying to make it more interactive and feel like we're in person again. The webinar is being live.
What time would that be?
Okay, well, that's what I forgot to do was mute people. Oops. I'll get that.
Okay, I have.
There we go. Okay. We're being live captioned. If you go down to the CC button and click that, you can pull up the live captioning options. And currently we don't have the ASL interpreter in, I think, our chat box, but if they jump in, I'll add them in promptly. Before we turn over the time to Dr. Rodrigues and Lauren, I'm going to just briefly introduce them. So Dr. Verity Rodrigues received her master's in special education and her doctorate in school psychology, both from the University of Oregon, where she focused on implementing social and emotional learning and positive behavioral supports at a systems level in school settings. As a school and clinical psychologist at the Treatment and Research Institute for Autism Spectrum Disorders, or Triad, she works across Triad's school-based professional development team and provides clinical services within the Division of Developmental Medicine in the Department of Pediatrics at BUMC. Much of her efforts across school and clinical settings focus on mental health and autism. As such, she is either working with educators to help them better understand and support autistic students, or working directly with autistic or neurodivergent children and their caregivers. Dr. Rodrigues also served as an advisory board member on the Mental Health and Developmental Disabilities National Training Center. And our co-presenter, Lauren Weaver, who works as a board-certified behavior analyst in pediatrics and director of community engagement for Vanderbilt Kennedy Center's Treatment and Research Institute for Autism Spectrum Disorders, or Triad. I can see why y'all go by Triad. That's a mouthful. She earned her BS degree in elementary education from the University of Alabama, Huntsville, and an MS degree in applied behavior analysis and developmental disabilities from Auburn University. Lauren strives to provide quality behavior analytic services and build the capacity of other individuals and systems to increase the quality of life for individuals with autism spectrum disorder and related disorders. Lauren coordinates Triad's community engagement program, including the Inclusion Network of Nashville, innovative partnerships to create a community network of arts, education, athletic, and entertainment organization that works to promote full inclusion of children and adults with IDD, autism, and other developmental disabilities and their families. This program has been awarded the 2014 Autism Tennessee Costin Education Award and the 2017 American Association on Intellectual and Developmental Disabilities Community Inclusion Award. We're really excited to have both of these presenters. I enjoy working with them both one-on-one, so I'm excited to see what they have for us today. So without further ado, I'll stop talking and I'll turn the time over to y'all, and you guys can take it away.
All right, thanks Ty so much for those introductions. So I think our first, right off the bat, we've got a poll question, Ty. I apologize for that. So, so we want to first just find out who we're here with today. Okay, so if y'all could just answer this poll question, we'll get an idea of who's with us. It's great to see these polls, and as everyone is sharing, fun to see the data come in, right? Like, ooh. So far, lots of related service providers. All right. Seeing a few more numbers fluctuate there. All right, how are we doing with that, Ty?
We are pretty good. I'm going to briefly apologize that my poll saved as one poll rather than the 3 individual questions. So you've got the answers to all 3 questions. I'm sorry. So I'll have to go back over them.
That is okay. That is absolutely fine.
That looks like that's about everyone too.
Okay, awesome. All right, so this is great. We've got a lot of related service providers. We have some family members, higher ed professionals, so we've got some self-advocates in the audience, some folks from Lend. This is great. Some one IDRC individual. Anyone that we've missed, feel free to type it in the chat, or if you want to go ahead and just quickly unmute, you're welcome to do that as well. Anyone, because we likely have missed. Let's see. Got an other in the chat, a service provider. Yep, direct service provider. Awesome. Long-term care, statewide youth ambassador, Center for Independent Living, social worker. I put K-12 teacher, but I'm a school social worker. Awesome. Oh my goodness. Yep, lots of fun. A consultant supported employment. This is awesome. We have a ton of folks in the audience who are joining us today you all have such a wide experience and skill set and just experiences that we're excited to learn from. So we do want to make this as interactive as possible. So feel free to use the chat. There are going to be times where if you do feel comfortable unmuting yourself to share, we'd love to hear your thoughts and your comments. So real quick, we also want to get an idea of where you're coming from, where you're zooming in from. Now we're all virtual, and so it's likely that you're coming from all over the US, and potentially there may be some people from outside of the US joining us. So if you could just go ahead and feel free. Oh, we got, okay, this is great. This is hard to keep up here. Ontario, Canada, we've got Maine, we've got, so the East Coast, we've got Southern folks, Charleston, Kentucky, Richmond, Virginia, another Ontario, Canada, Montana, Cincinnati, Amarillo, Texas, Wisconsin, Jersey, Billings, Montana, North Dakota, Ohio, Virginia, Oregon. This is awesome. Okay. Connecticut, Oklahoma, Sydney, Ohio. You all are coming from all over the place. I think this is one of the benefits. There's a lot I don't like about Zoom, and I'm definitely experiencing some Zoom fatigue myself, but I do love that we can all connect from all over the place in the comfort of our own homes or wherever you may be. So that's exciting, and welcome. Welcome to all of you. All right, so we're going to give a quick overview of our presentation today. And what we hope to accomplish is to describe some of the programs that we do offer at the Treatment and Research Institute for Autism Spectrum Disorders. I'm just going to call it Triad from here on out. We're also going to hear a little bit about both Lauren's and my lived experiences. And we're going to identify just some key takeaways or skills that we would love to share with you all. We're also going to just for a sec, we're also going to talk about some next steps for Triads advocacy partnerships. And then we're going to hopefully have some action steps and considerations for building meaningful collaborations. The big thing at the end is we're going to break out, hopefully, into some breakout rooms. And we've got some key questions that we would love for you all to think about and to give us some feedback as well. So we hope to share some information with you all, but we really are excited about gaining some information from you guys as well. So with that being said, I want to talk to you a little bit about our mission at Triad and kind of who we are. So as Ty mentioned, the Treatment and Research Institute for Autism Spectrum Disorders, or Triad, is an entity housed within the Vanderbilt Kennedy Center, which is also housed within the Vanderbilt University Medical Center. So we are kind of split and kind of housed among both of those larger organizations, larger entities. Through our various clinical, educational, research, and community programs, our overall mission is really to empower autistic and neurodivergent individuals by honoring their identities across all endeavors. And we accomplish this through strengthening direct service and education for all people with disabilities, and also by bolstering the support and advocacy of their caregivers, the communities, and professionals who serve them. So that really is our mission. But then how do we actually go about engaging in that mission, right? Who are we and what do we actually do? Because I can tell you we do quite a bit at Triad. So our team is comprised of a mix of individuals from various backgrounds. We have clinical folks coming from the clinical sector and from research, as well as a large portion of our colleagues come from the education field. The majority of our team includes teachers. So we have educators, psychologists, speech language pathologists, as well as behavior analysts. We also have an amazing team of administrators and infrastructure folks who provide their expertise in project management, in graphic design, in online course development, and video production. Because a lot of what we do, and I'll talk a little bit more about our Department of Education work, but a lot of what we do is develop resources, and a lot of those are online resources through videos and online modules for not only educators, but also for families and individuals. And so we have to have our strong infrastructure team to come in and really help us with those things. So what exactly do we do at Triad? We have various different arms within our organization, and I'm going to kind of briefly go over some of those. So the first one is our clinical diagnostic services. And these are housed within our Division of Developmental Medicine, which is through the medical center, Vanderbilt University Medical Center, and also integrated primary clinical care. And we do quite a number of training services across Tennessee as part of a large HRSA training grant or research grant. We also have a resident training program with the medical center, where as part of my clinic, we have resident trainees in pediatrics coming through and learning about autism and related developmental disabilities, and learning how to coordinate care, how to screen young children, and even be able to diagnose young children to, again, be able to increase access to care for those young children, knowing that their pediatricians are often, for families, often the first people who kind of that first point of connection and first point of care that children usually have. So trying to reach that sector and provide training and support around autism. Our research arm is really, really big. Triad is involved in many different clinical and translational research programs aimed at improving outcomes and quality of life for autistic individuals and their caregivers. This spans from training primary care providers, as I mentioned, in early autism screening and coordination of care, to developing innovative tools for enhancing employment practices for neurodivergent individuals. Those are just to name a few. And when it comes to collaboration, there's a lot of collaboration happening with Triad researchers, with the Department of Engineering, with Department of Physics, with you name it. There are lots of some key collaborations happening there to build and expand research in this area. And then we have our community and our educational and professional development and outreach arm, excuse me, which in addition to Triad's research is a very large portion of the work that we are engaged in. And this is really going to be the focus of what Lauren and I are going to be engaging with you about and talking about throughout the rest of this, this talk. But we have, as Triad, we have a long-standing partnership with the Tennessee Department of Education to provide training and coaching support and resource development for K-12 educators around best practices for supporting autistic students. And this longstanding, we're going on our 23rd year, consecutive year of this partnership. So we're very proud of this partnership and really proud of the work that we do to support educators in those partnerships that we have with districts across our state. We also have a very longstanding partnership with our state's Part C early intervention services to train early interventionists across the state in evidence-based practices for young autistic children. So again, here we're partnering not only with those Part C providers, early interventionists, but we're also partnering with families as well. And so that's an exciting partnership. Then we have our Families First program, and this is a program for families of young children newly diagnosed with autism. As part of this program, we provide monthly trainings. We have opportunities for families to network and connect with each other. And we also offer a wide range of online resources that families can access from the comfort of their own home. And so this really is, again, to help coordinate care for those families and be able to provide as much accessible information to the families that we work with across our state and even outside of our state as possible. So those are just, again, some of our core programs. Lauren's now going to talk about our community engagement work and the AllAccess Inclusion Network, which she directs and is very much involved in.
Wonderful. I love listening to other people share about all the work that we do at Triad, and just very proud. And I wanted to highlight two things that I think help us be so successful is that we build capacity within, well, that's the first, we're looking at building capacity. We're not trying to be the provider of all the information, but rather really empowering others to help disseminate the important information. And secondly is embedding our work into systems that already exist. So we're not trying to create something from the ground up. All of our work is embedded in other systems that are effective at reaching the people who need the services, whether it's the early intervention system at our state, the Department of Education. We're working within successful systems already. And that's really how the AllAccess Inclusion Network has formed as well. So to start out, we started this network in 2013. It's still a new program, really. And it started with feedback from families who were participating in Families First, saying, they were receiving really good information through the workshops and the resources that are available there. But they said they felt like the needs of their family were not known in our community. And I don't know, I didn't see anyone else say they were from Nashville, but if you've ever been to Nashville, we have a lot of fun stuff to do. We have a lot of cool community programs. We're one of the it cities I hear on the news. And so if it doesn't matter if there are one opportunity or 100 opportunities, but we truly believe that everyone should have access to participate and contribute to these community settings. You can read about an elephant in a book. You can watch a video about an elephant, but there's nothing like going to the zoo and seeing an elephant or feeding an elephant. And so everyone should have access to these opportunities. So we took the feedback, and of course we wanted to do something about it. And so we reached out to some of our community organizations that we had an existing relationship with. There we go. I hear someone knows someone in Nashville. So you've hopefully been here, Kate. And so we reached out to these existing community organizations that had successful programs, that had successful outreach, but we wanted to see if we could bolster up their accessibility and inclusion, especially for neurodivergent patrons. And so when we reached out to all these organizations, no one said, oh, no. We are excluding those people, right? Everyone said, we want to be inclusive. We just don't know what to do, and we don't want to do anything wrong. And so that was our first barrier. Let's empower and build capacity within these organizations to promote. This goes to our mission, really to promote awareness, but beyond awareness, not just that this exists, but really increasing accessibility in physical spaces, integration, allowing social opportunities for neurodivergent individuals, and the inclusion of neurodivergent people through building capacity in this network of organizations. We are stronger together. That's what our focus is today, is the collaboration piece, building partnerships. And we decided, instead of doing this work in silos, let's do it together. Let's collaborate and partner. So let's take a moment and just watch a brief video about the Inclusion Network. You can see a little bit of it in action. Hopefully the internet is working for us today.
Really quick, are you able to see that?
I can see it, yes.
Perfect, okay.
Let's make sure we have the right sound sharing. No, we don't have sound, Verity.
Do not have sound, okay. All right, 1 second. Do you think it would help if I unplugged my headphones?
I think when you share your screen, you have to check to share the sound as well.
Okay.
Yeah, then if you're able to reshare, there's special options within the sharing.
Yep, got it. Optimize for video clip. Yes. Okay.
In a world of worry, we're working to create days of joy. The AllAccess Inclusion Network is a collaborative effort with self-advocates and a collection of community arts, education, athletic, entertainment, and disability-focused organizations. We're working together to promote awareness and create opportunities to increase accessibility and inclusion for autistic individuals and related intellectual and developmental disabilities across the lifespan. Our network is unique because of the number of organizations working together for this common mission. We're pushing beyond accessibility to inclusion, where we all belong and are working together with diverse abilities. We believe we all benefit from the unique perspectives neurodiverse individuals add to our community as patrons, volunteers, and employees. Together, the AllAccess Inclusion Network, which is led by Vanderbilt Kennedy Center's Treatment and Research Institute for Autism Spectrum Disorders, is changing the way we implement programming to include evidence-based supports and changing mindsets to open doors for representation at community organizations. Together, we're all in.
Awesome. Thanks for that feedback, Gina. I see some feedback pushing past diversity, inclusion, and equity to pushing to belong. And that's the feedback that we've had. So the network is made up of community organizations, as well as disability-focused organizations and self-advocates. And so we have grown to 24 community organizations across 3 cities. And we're able to expand now, actually, thanks to Zoom, and 16 disability-focused organizations. So together, the individuals and organizations, I feel like we're all in this together. So I'm responding to things, Gina, you're sharing in the chat and getting distracted. But we're working together to be the network. And we do have this focus. We're not just creating sensory-friendly days and saying we're inclusive, that we're really pushing past it to create opportunities to contribute and to belong. And so, Gina, I love that quote, and that's something we talk about all the time, but I'm going to expand to it and say, it's not just about being invited to the dance or being asked to dance, but truly creating a place where everyone is comfortable dancing. It's about shifting the culture to truly value all people and the contributions that we can have when we're all working together. So as we're talking about building capacity, as we're talking about collaboration and partnerships, there are a lot of layers within the AllAccess Inclusion Network. And I think that's why Verity and I wanted to share about it today. There are things that we have done well and things we have not done well. And so I was very excited to see that the people here that we have today coming from so many different areas of background. So that's why we're, at the end of this, we're going to ask for your input to help us do better. And so collaborating even within this, I feel like I never want to settle that what we're doing is good. And that's what all of these organizations here are committed to, is an ongoing process to always do more, because inclusion is never achieved. Inclusion is a process. So I'm going to pass it to Verity, and she's going to share a bit more about what participation, what does it really look like to be a part of the AllAccess Inclusion Network, which was previously called the Inclusion Network of Nashville. But as we expanded outside of Nashville, we have renamed ourselves to be a little bit more clear about who's involved.
Absolutely. So just to let everybody know, I no longer can see anyone or myself. So I'm just seeing the slides, which is, yeah, so kind of, yeah, talking to nobody here, which is not good. So hopefully Ty might have an idea, or Lauren, you may have an idea as to how I can get the pictures back. But definitely, I would so love to talk more about what it actually looks like in terms of collaboration regarding the AllAccess Inclusion Network and just the work that we're doing with organizations to support true inclusion. So there are kind of 3 specific aspects, right, that we that this work looks like. So training, collaboration, and dissemination. So I'm going to go over these, and then I'm going to talk a little bit about the experience that I've had, and I'm really honored to say that I get to do this as for my job, which is something that I never imagined or could dream of when I first started out my career. But the fact that I get to work with the Nashville Ballet and the Nashville Symphony and work on building a more inclusive city, right? And be able to build these opportunities for all individuals in Nashville is really exciting. So in terms of training, you know, as part of the AllAccess Inclusion Network, we have lots of different opportunities to train staff and volunteers by our, Vanderbilt consultants, right? Our Triad consultants. But also we're, with many of our organizations, this information, and they're training their own staff, right? So we're, again, building that capacity within these organizations to just continue the work so that it's not contingent on us, being there. We're really working to do that. So there, we provide lots of opportunities to train accessibility coordinators at community organizations. And then, like I mentioned, providing these materials for them to facilitate that process. And so these are some great comments. I'm really loving it. But yeah, keep the comments coming in the chats, please. So providing these trainings so that the community coordinators at these community organizations can take that information and also make sure that they're able to tweak it and make sure that it is not only that it's also accessible for their community, right? So when I'm working with the ballet and working with them, when I'm working with the symphony, There are different programs that they run. There are different activities that they provide for their patrons. And we want to make sure that they're able to take that information and really work towards building inclusivity across all of their programming, right? And I'll talk a little bit more about the culture aspect, right? Organizational culture. And so we also have ongoing topics and training topics provided by experts at disability and community organizations. So we have partnered with a number of different organizations, disability organizations, and they're able to come in and provide their own expertise and share their knowledge with our community organizations, again, to just continue to enhance awareness and to build that capacity. So that's training. When it comes to collaboration, I feel like this is where really where the rubber meets the road and where so much of the work that we do really helps to enhance and move these organizations towards true inclusion. So, with other community organizations, community members, including neurodiverse individuals and disability organizations, are all coming together, right? The AllAccess Inclusion Network is not just community organizations. It's not just a group of disability organizations. And it's not just neurodivergent individuals either, right? We are all coming together with a shared mission, a shared vision, and really a shared goal to make Nashville, and hopefully expanding even outside of Nashville, to make it truly inclusive for everybody. And again, all of those different perspectives come together to make that work really happen, essentially. So we're all working together. We also provide customized consultation provided by Triad Consultants. So I'm one of those consultants. As I've mentioned, I get to partner, and I have the honor of partnering with the Nashville Ballet and the Nashville Symphony to help support their mission and vision when it comes to true inclusion. And so, we partner and we have coaching calls monthly, and we partner to provide trainings. What we've been working on really focused on so much of this year, especially with COVID, is, last year we started this work and then COVID hit, right? And both of those organizations, as well as many across our city, had to furlough so many of their staff, right? And their especially volunteers kind of had to stop, but then their staff members, also many of them had to be furloughed. And so a lot of the work we were trying to do or starting to do around employment and around really building this organizational culture around inclusivity and inclusion kind of came to somewhat of a screeching halt, right? We were really making great headway, and then COVID hit. So now that both of my organizations, the ballet and the symphony, are in the process of hiring back many staff, either staff they furloughed and then also onboarding new members to their organizations. This is really a huge focus, right? Training is a huge focus right now, building that awareness and really building that culture of inclusivity in terms of making sure that inclusion for neurodiversity, inclusion for individuals with disabilities is front and center in their mission statement and their vision statement, right? So, both of those organizations are really focused on training, on building that organizational culture around inclusivity, and as well as employment, and really, working with their HR departments and helping to really think about inclusion from every different angle and every different aspect, because that's really true inclusion. That is the journey that these organizations are on with us all. So we also have biannual network meetings, right, with conversations driven by network needs and also focused on further reach and growth. So, our partner organizations will come to those meetings with great questions, right? Things that they are grappling with, things that they are looking for some community and some support and collaboration around. And so that's why this network is so powerful. Is being able to have these different organizations come together again around a focused goal and a clear direct mission that they all share has been really the power, I think, in that collaboration. And so then we have access to a network online forum as well. So we, there's opportunities for collaboration, not just at our biannual meetings, but throughout the year. And then we're also being able to, as Triad consultants, work with each other as well. So we're kind of collaborating as well within our organization to help support and connect our community organizations when they have, similar needs, similar successes as well, and helping them kind of build off each other in that way. Okay, so then dissemination, right? This is again, a really big part of what we do. And this really stems from that communication with our community members regarding inclusive opportunities at organizations through social media, through newsletters, emails, website. So much of what our organizations do is they're putting supports in place. Yes, they are making all of their activities and all of their performances truly inclusive. But then how are they communicating that information, right? And that is really a huge focus of what they're doing, the work that they're doing as well. So sharing their accessibility supports on a resources directory as well, right? So trying to get that information out there to the community. So not only can the community access those resources, but then there's that loop, right? That feedback loop of families coming in, using the resources, and then also being able to share back with the community organizations about how that worked and what can be improved upon. Marketing materials regarding their involvement, right? So their involvement with the AllAccess Inclusion Network and trainings and activities. And again, so much of what Lauren talked about at the very beginning, which was the AllAccess Inclusion Network really came from the feedback and input of families through Families First, right? Families we were working with. And so we want to make sure that loop, that feedback loop is continuous and that families understand and know, oh, when I go to the zoo, when I bring my family to the zoo, or when I go to the ballet, they're part of this AllAccess Inclusion Network. This is part of their mission, right? Inclusion is part of this organization's mission and vision. And that's important for families to know and to understand. So, Lauren, what am I missing? I know I'm missing quite a bit. So, chime in.
Well, I just saw a comment that was sent to me asking about remote services for training for employment opportunities. And I was just commenting back that is a great option for some, but we have to be careful with how we present information to organizations that they don't think that that's the only option. Because what we don't want is for an organization to think that by having a sensory friendly day or a remote employment option, that would be the only opportunity for participation. We don't want to do separate but equal, because we've done that in the past and that didn't turn out very well. So it's a great option for some. And I think that's the hard part about this work and the training aspect, is that there's not just one way to make progress towards inclusion. And so we're really trying to build capacity. We have one representative from each organization, and we're trying to train them to be the accessibility coordinators. I wish, and I'm picturing this future where organizations have employed a person whose responsibility is to think about accessibility and inclusion. Most organizations, especially that we work primarily with nonprofits, are not there yet. But I'm excited that we've been able to at least make this a part of someone's role that can provide challenges, and that they are responsible for other things, but that this is a piece of each organization, whether or not it's formal or informal at this time. So that's the training piece, is really building capacity within their own organization to have accessibility coordinators or directors. The collaboration piece is something I'm going to speak to a little bit more in just a bit when I talk about my own lived experience. But that's one of my favorite parts, is watching organizations connect together and share what's worked and what's not worked. We've created a culture within our network that says you don't have to think, like, it's okay to share what didn't go well. Like, that is just as helpful to organizations as what did go well. And I think dissemination is important. A lot of community organizations, and even I've seen a lot of family members or even individuals, it's hard to communicate the difference between accessibility and inclusion. And so striving beyond a sensory friendly day to make every day sensory friendly day, and then opportunity to contribute or belong. And so I think that's one of the biggest challenges we have right now with dissemination is, like, we are not going to provide a certification to an organization. That doesn't seem appropriate because that's a false sense of accomplishment. We want to keep going because you can always do more. And so, there are a lot of stories and feedback we get that encourage us to keep going. One of my favorites, Verity, is from the symphony, and it was after their very first inclusive children's programming. And a parent took the time to write us a letter and a collage of pictures, and said that they had a hard time finding something to share, kind of have enjoy this common activity with their child. And their child loved symphony, loved orchestra music. And he would take his animals and arrange them and have, I think the giraffe was the conductor. And that's what he did. So when she saw that Nashville Symphony had a modified and inclusive opportunity for their family, they jumped on it. And she said that her and her husband, when they sat down in their seats, both made eye contact and just had tears of joy. As a parent myself, you worry about every interaction. As a parent of a child with autism, that can be amplified. And so in a world of worry, to create opportunities and days of joy is something that's important, and everyone should have the right to. So I think that's what the challenge is getting the word out there that it's more than just allowing people to be there, but allowing people to participate and contribute.
Absolutely. And and I feel like there are many stories that we've experienced. I think both ourselves going to events, working with these organizations, and hearing from families. And that's really what this is all about, right? It's really about the individuals themselves and their families. And so, so I'm seeing so many amazing chats, and oh my gosh, so many great kind of thoughts and comments. One that I just wanted to kind of speak to, Jen mentioned our disability network has adopted the theme, disable the label. We have been able to get other agencies and organizations to also spread the word because it is so simple and it is inclusive. 100%, Jen. I think there are so many things that we can do and organizations can do that they're not hard, right? But it's a shift in our mindset, right? And it's a shift. It is maybe a shift in the way that we do things, organizations do things, but it's not hard. And that right there is something that I can speak a little bit to during our lived experience portion about as a psychologist and having to provide labels, which goes against my every grain. And so I think that is, I take that and I hear that on both a personal and professional level, and just think you're absolutely right. It is so easy and it's so simple and it is so inclusive. So that's one of my challenges, is to think about what are those simple, easy things that we can do to that have a big impact, right? That have a big impact in shifting culture. So now we want to hear more from you. We want to hear about your experiences with engaging and seeking input and engagement from stakeholders, right? And it sounds like everybody is coming in here with different backgrounds and different roles within your own organizations. And so given that, when it comes to stakeholder input and involvement, how do you seek input and engagement from stakeholders? So yeah, go ahead and answer that poll.
We're at about 60% of people
Awesome.
responding. We'll wait just a couple more seconds and then I'll end it and share the results for y'all.
Thank you, Ty. All right. So it looks like kind of a good spread, very frequently, occasionally as needed, is really the bulk. So this is fantastic because our next poll question is how would you then rate the extent to which stakeholder input is incorporated into your organization or the work that you do? So sounds like a good percentage of you all do actively seek input engagement. So then how are you using that? Or how would you rate the extent to which you're incorporating that?
I think we've all seen where we have good intentions to get input and we don't have the right partnership to make it meaningful or to change what we're doing. So I'm curious to see. I love that a majority of participants here have the opportunity to get feedback. That's step one, but step two is using it. So I'm excited for the next poll.
Is this the, okay, there it is. Sorry,
Yes.
Sorry.
it was laggy.
While we're waiting on these poll results, I'm going to share something that just came up from a family member of mine who has some physical differences. And he went to a disability awareness night at a local baseball, like minor league baseball team. And the activities they had where they invited people they were throwing like souvenirs to the people, but in order to get the souvenir, you had to stand up and catch it. And so there was some disconnect, like there was a good intentions about having disability awareness night, but the way that it was implemented, it was clear they didn't have a lot of feedback from the stakeholders that they were trying to raise awareness for. So I think that's a good example of how there's good intentions, but it's not followed through. More input, more collaboration would be beneficial.
All right. So it looks like majority of you all, really to a great extent are incorporating your stakeholder input or somewhat. So that's great. That means that towards the end, when we do our breakout sessions, you will have some really good feedback and information to share with us because we are always learning. We realize, I think both Lauren and I realize that this is this journey we're on a journey, right? It doesn't end. There's no like endpoint to inclusion. We're always learning and growing, and it's a journey, right? It's a journey. So we're excited to hear and be able to gather your feedback. I'm just going to close that poll. All right. So now both Lauren and I are going to share about our own lived experiences. Mine is a psychologist and Lauren's is a behavior analyst. But really, it's interesting. Ty had both asked Lauren and I to reflect on our lived experience as professionals and to share a couple of kind of key takeaways or guideposts that have helped us build partnerships for meaningful collaboration. And honestly, when Ty shared this with me, I wasn't quite sure where to begin. But as I reflected on my own lived experience as a psychologist, I realized that collaboration has been the central component in every one of my professional roles. So I'm really going to speak to collaboration. I've got two kind of skills, and I guess they could be skills and or guideposts that I, in my work now, lean very heavily on. So I think that's going to be important. There's a lot more that I could say around inclusion specifically in my role as a psychologist, but I'm really going to focus on, I think both Lauren and I are going to focus on collaboration and building meaningful collaborations. So I know for me regarding collaboration, there have been many successes as well as many failures along the way, but developing meaningful collaborative partnerships continues to be something that I greatly value in the work that I do. So I'm going to talk to you about two guideposts. So the first one is listening to understand. So I first learned that listening to understand is critical for meaningful collaboration in my very first job as a school psychologist. I was brought into a district to work with 2 schools actually in developing and implementing a multi-tiered system of supports for both academics and for social emotional learning, okay, or mental health supports. This was it was a collaborative effort, and I knew it would take several years. In many situations, it usually does take about 3 to 5 years. But in one of my buildings, there was little to no culture of collaboration, right? And this was a huge red flag for systems change efforts. So I was coming in already pretty nervous about this. The culture in the building was very much for teachers to go into their classrooms, shut the door, and teach until the dismissal bell rang, and then do the same thing the next day. Okay, so it was really alienating, and honestly, it was the opposite of collaborative, right? So once I spent a few weeks in the building, I knew that true collaboration was going to be challenging, right? And meaningful collaboration was going to be challenging, but I knew that we had to start somewhere. So I began facilitating meetings with 2 teachers at a time and listening to truly understand their perspectives, their values, their passions, and their fears. I met with each and every teacher and administrator in the building with the sole purpose of listening to understand their unique perspective as it related to their role in the building specifically. So what was interesting was the act of listening to understand and being listened to and understood provided this bridge for forming professional learning communities, which further strengthened collaboration among the faculty, right? So that was that initial bridge. We had professional learning communities. And then that process set the stage for meaningful collaboration to really take hold. It took about 3.5 years, but working together toward that common goal, we were able to develop a comprehensive system of support for academics that included ongoing intervention collaboration, weekly professional learning communities. And not only did student achievement soar, but the entire culture within the building was completely transformed. Without listening to each other with that intent to truly understand one's perspective, I really think meaningful collaboration would not have been possible in that building. So that listening to understand, I think is something that we've all experienced, right? We've all experienced being listened to, but being listened to with the other person's intent to truly understand our perspective, it has a very, very different feel. And I can tell you early on in my graduate years and graduate school years, that was something, listening to understand was a skill I did not have. I very much listened to respond. I was not only a people pleaser, but I was also a problem solver. I really wanted to come in and help people solve their problems. And so I would listen, but then constantly be thinking, okay, what is the solution, right? I was very young, I was very inexperienced, and it came from a really good place, but it was not the way to form meaningful partnerships and meaningful collaborations. So I had to learn that, the hard way, had lots of failures. But again, I'm still learning that, and still learning that listening to understand is a fundamental aspect of building meaningful collaboration and partnerships. Whether I'm working with an individual, whether I'm working with a group of people, or whether I'm working with an entire organization. When I work with rural school districts in Tennessee, this is definitely a skill, a pillar that I lean heavily into. Or whether I'm working with the ballet or the symphony on, helping them to build in their system of inclusion and helping to move their goals forward and partnering around that. This is something that I definitely lean heavily on. All right, the second guidepost or skill, and I truly believe that both of these things are skills that can be learned, is presuming positive intent. And again, both of these things, we all have our own lived experiences that relate to both of these elements, right? So presuming positive intent is definitely a skill, but I would also say it's a guidepost that has allowed me to successfully navigate some complex environments and situations. When conversations have taken a challenging turn or when conflict has arisen, presuming positive intent has truly been the catalyst to get everyone back on track. So in my role as an instructional and behavioral consultant, I often encountered challenging situations where communication had ceased and families were on the verge of entering into due process. These were incredibly tense situations for everybody involved. And I noticed that adversarial relationships were forming, right? These were really, really tough situations. And, on both sides, there was perceived ill intent. So in an effort to avoid due process, school districts would often call on me to come in and mediate the situation, which is, it's not good, right? My role as a psychologist is to work with students, to help families, to hopefully, prevent any aspect of due process even coming into vision. So school districts would then call me in, right? And to help get this process back on track. But integral to getting the conversations back on track and avoiding due process was me walking into these situations, presuming the positive intent of all parties involved, right? I had to approach the situation with the understanding that the actions of every single person at the table was done with the best interest of the student or the child in mind. Then, once I came in with that, intent, right? And with those presuppositions, with the way that my language, the way that I would help to mediate those conversations, then everyone in the room needed to be reminded of that exact same thing, that everybody is coming in with positive intent, okay? Only then were we able to actually begin to move the conversation forward and to collaborate in a meaningful way. So I'm sure we've all experienced tense, difficult situations. That is definitely an extreme, right? An extreme example, but we've all had situations, whether it's with our loved ones, whether it's with colleagues, of where conflict has arisen and tense situations have unfolded. But we want to be able to collaborate, right? We still want to be able to collaborate and engage in our shared vision and shared work. And so presuming positive intent is a skill that I can tell you, it has changed me as an individual and as a person. It reduces my own anxiety, right? And helps to bolster my own wellness and well-being when I'm entering into tense situations or when conflict arises. And it truly has, if it's worked in the most tense of situations I've been in, I can tell you it can really change and shape a situation from being more challenging to being meaningful and collaborative and getting back on track. So with that being said, I'm going to now turn this over to Lauren, and she's going to speak about her own lived experience related to the work with the AllAccess Inclusion Network and helping organizations be truly inclusive. Lauren, take it away.
Yes, thank you, Verity. When we were preparing for this presentation, I did not want to follow Verity and her sharing her own lived experience. I think that's what's challenging, is that when I heard lived experience, you have to admit that what you've done isn't always the best, and that we learn and grow. And so I'm not going to start at the beginning of my lived experience. It was a cold, rainy Tuesday when I was born, just kidding. But I'm going to focus on my work leading the AllAccess Inclusion Network. I know that I've talked about how it has grown organically with feedback from the needs of individuals and the community. It's not always rainbows and butterflies, but what I do want to focus on is what has worked well, because I think that's what we're here today. Is to talk about what does meaning collaboration look like for partnership. So when I thought about this, there were two takeaways that stood out to me. And the first is that meaning collaboration means that you don't have all the answers. It's hard to admit. Often when you come into a room, you're expected to have all the answers, or at least pretend that you do. And that's not going to lead to meaningful collaboration. If you had all the answers, why would you need to collaborate? So I'm not a diversity and inclusion expert. That's not what I'm trained. But I am a passionate person who believes that we are all better when everyone is included. So I do have resources with Triad to connect and amplify voices, as well as needs from the community. And so I've used my organizational skills that I have as a professional, and has allowed me to be effective at sharing information. We talked about the first barrier that we encountered when working with organizations around inclusion was, I don't know what to do, so I'm just not going to do anything. So we're sharing information to break down those barriers and build confidence in the community to include more people. So a lot of what I see my role as the director of community engagement is connecting people, voices, and perspectives. The AllAccess Inclusion Network works so well because organizations are willing to collaborate rather than compete to share what is effective in serving their patrons, as well as what has not worked. We have not always done the best thing, but in order to make progress, we have to keep going. So some examples of ways that we're able to collaborate, because we don't have all the answers, is when we're able to connect Tennessee's Performing Arts Center to the National Children's Theater. They have similar programming, they're performing organizations, and so they're able to collaborate and work together to be more effective at including people. Another great example is the Nashville Zoo is in the process. We're very close to having a all-inclusive playground opened where we've been able to accommodate, think about physical accessibility, but also work with them to develop accessibility supports for neurodivergent people or cognitive disabilities. Just down the road, about 10 miles south, another community is looking to build this. So we're able to connect YMCA to the organization working with the zoo to have a faster and more successful playground being built. So we collaborate because no one in the network has all the answers to this never-ending process to increase inclusion. Other ways that we are able to collaborate is from voices of people who have lived experience with disabilities. So a few examples to share with you. Lynn Bingham, who is a professor at the Vanderbilt Blair School of Music, has led our network at our biannual network meetings a lot of times. One of my favorite activities that she has provided to us was the Radical Inclusion Challenge. So she presented to our community organizations and asked them to think of the most radical example of inclusion at their organization. Your CEO has autism. What is the most radical way that and inclusion, thinking about contributions? And then she went through and asked each organization, why is that so radical? What are the steps that we can take towards that radical vision of inclusion? She asked organizations to reflect and think, do our actions match what we're telling the community or what we're telling ourselves? She really pushed people to a place where they were uncomfortable to make progress, to go forward. And Lynn has autism. We've also hosted employment panels with a variety of people with autism, as well as employers who have successfully employed people with disabilities. One of our panelists is Dan Berger. He is a web and mobile developer at Vanderbilt University, working on astronomy, high performance computing, and autism research. And something he said stuck with me that I want to share with you today. He said, in order to solve new problems, you have to have people who think new ways. And that couldn't be more true. And so the thought of inclusion, there's no roadmap to how to do this successfully. And so we have to bring in people who think differently and have different experiences to be most successful. Dan is proof of this. You can also find him on CBS. CBS's 60 Minutes with Anderson Cooper. It talks about how he was able to invent software that is now licensed by NASA to interpret a large amount of information from telescopes. And Dane was able to create a breakthrough way to analyze the data and look at the data to move forward in astrophysics. So that's an astrophysics example of looking at information in new ways, and we need to do the same thing when thinking about community engagement. The second point that I wanted to talk about with meaningful collaboration is it means that all parties must have the opportunity to contribute. Verity, you can click on that next one. One more. There we go. So you must allow for both parties or all parties to contribute. Those go hand in hand, right? Without tokenism. That's right, Gina. And so that's what we are focusing on more than ever. So Lynn Bingham, I shared, she's the professor at Blair School of Music who implemented the Radical Inclusion Challenge. She has also been absolutely instrumental in pushing our network in all of our community organizations, from thinking about accessibility, from thinking about quiet spaces and sensory friendly days and fidgets, to true contributions and opportunities to participate and belong in physical spaces, but as well as social spaces. And so we're thinking about shifting cultures at organizations. We're going big because we want to do it well. And so shifting cultures at organizations to truly value everyone. Organizations can say, oh, we value and we want to have a neurodiverse or a diverse staff. But if the supports and the actions aren't there, it's not going to be successful. So Lynn is a leader of our network in challenging organizations to have this perspective and to have actions that match it. Another example is Claire Burnett, another adult with autism who was the previous communications coordinator at the Frist Center for Autism and Innovation. She's actually going on to earn her graduate degree in North Carolina. But she has led trainings for us at community organizations for HR departments and thinking about modifying hiring practices that are going to be more effective and less, there are going to be less barriers that shouldn't be there for, that are there for no reason in hiring a person with a disability. So we've asked Claire to lead that, a person with lived experiences to lead those trainings for us. It's not just Triad folks sharing information, but it's people with lived experience collaborating and sharing information and teaching Triad in the meantime. Dave Caudell is another one of our self-advocates who's the associate director at the Frist Center for Autism and Innovation. He's one of our greatest collaborators. So he's presented many times. And so by having these people as leaders within the network allows their voices to be amplified. It's not Triad talking, it's the lived experience saying to our community, this is what we need to do. This is how to do it well. And that ongoing opportunity for feedback and direction. So we have the feedback from the neurodiversity lived experience. So we also have opportunities for input from the community organizations. What's their lived experience? And so how have they been successful at advocating for the time and resources to embed this in the organization's mission and strategic plan? How are they including neurodiversity training as part of their standard onboarding process? Not this like special presentation that we're going to have on autism today, but how is it embedded within your everyday processes? How are you seeking feedback from patrons? So we're also challenging them to get feedback in their own programming, in their own events, and how have they created and hosted new or modified programming. So there are so many different layers and opportunities for collaboration and input from everyone who has different input and contributions from everyone who has a different perspective to make this successful. So the opportunities for this network are endless. And at the core, we hold each partner accountable to collaborate and contribute. So no one is expected to have all the answers or that bad idea or share something that's going to end up being a bad idea. It's better than not contributing. So we've restructured multiple times because the direction keeps changing because it's an organic network. It's based on feedback and contributions from all parties. So we've gone through 2 or 3 complete restructures because we are learning as we keep going. So those, I would say, when I was thinking about this presentation and I was challenged by this thought about collaboration and the network, those are the 2 things that I think make us successful, is that we don't have all the answers, having that culture of you don't have to, and it's a safe place and we want contribution from all parties.
Hi, Lauren. Thank you so much. And Ty, I think with the remaining time, we would love to, actually, I'm gonna, hold on one second. I'm going to speak a little bit just about looking to the future, and then we will get into our breakout sessions. So here we go. Sorry. Oh, here we go. Okay, so looking to the future, kind of thinking about what Lauren had just said in terms of the All Access Inclusion Network, and really where do we go from here? So we are really working right now, actually, towards putting together a series of focus groups with individuals to be able to share their lived experience, and from there build an advisory group of individuals who we can kind of build some ongoing collaborative partnerships with to help inform not only the work that we're doing with the All Access Inclusion Network, but also the work that we're doing with our educational partners and through our Department of Education work, and what we're doing in our research work and our clinical work. And so, we're hoping that just that process will be able to kind of help us, just move to just really having that feedback loop of getting feedback from stakeholders, incorporating that feedback, sharing back with them, and developing those meaningful conversations. So with that, we would really love to get everyone into breakout rooms and hear your thoughts and experiences and share back with us. I know with this large of a group, it's really hard to do that, even over the chat, because we don't always get we're not always able to respond to every comment. But we're hoping that this will give people the chance to really engage with some of these questions. So Lauren put a Google Doc into the chat box. So what we're going to do is Ty is going to break everybody into individual breakout rooms. And within your breakout room, if you could just identify one person to be the scribe or to take notes on the Google Doc. And and then if that person can also, you should be able to share your screen. So if you could just share your screen so that everybody in your group can see what you're typing, that would be great. And so any questions before Ty breaks us into breakout rooms? I see Lauren has the Google Doc in there. All right.
Okay, perfect. I'm going to break this up into breakout rooms right now. It looks like they're going to be about 7 to 8 participants per room. So I'm going to hit the create button and it should create it. So everyone should be in the breakout rooms now.
Perfect.
And then Verity and Lauren, you guys should be able to have the ability to join any of the rooms if you want to, or if you need me to, I can broadcast a message to all of them. It looks like about 28 people have stayed in this main room, and the rest of the people have actually shifted out.
Are there a few folks, Ty, that that just need to, of the 28 people in this room, that just need to go to their respective rooms?
Correct.
Okay,
Yeah, there are quite a few people that it says that people haven't joined.
got it. Okay.
I have a few people who are messaging me, and so I'm trying to monitor the chat. They're wanting me to email them specifically about following up on some of this. So it's really good.
Awesome.
As far as timeline, Verity, just so I'm aware, are y'all wanting people to come back before y'all end?
I think we could have people, yeah, just like come back quickly before we end, and then we'll just wrap up. What do you think, Lauren?
Yes.
Yeah.
I think maybe if we give people like 8 more minutes or so,
Yeah.
8 or 8.
I think that sounds good because we're done at 11:30. So yeah, I think 8 or 9 more minutes. We want them to be able to get through the questions, but then we can come back, and if there are any kind of broader questions from the small groups, we can always.
All right, so I'll give them a 5-minute warning in about 3 minutes.
Perfect. Sounds good. I'm gonna join room 2 real quick, and then I'll be right back.
She was our screen share, so when she left, we lost the screen share.
Okay.
So when she joins back, just make sure to gently remind her to reshare the screen.
Okay.
And I also think, Lauren, this is technically another, yeah, technically this is one of the groups.
Okay.
right, I'm gonna bring him back in about 20 seconds. We're gonna just a little bit early so I can try to transition to that next room somewhat on time.
Yes, great.
Here we go. I'll close in 59 seconds.
Verity, when you left, we lost our slides. So if you'll get us, there you go. Perfect.
I am so sorry about that. I just saw I had a direct message from one of our participants, and I thought I would jump into her small group breakout room just to chat. I so apologize for that. That's
No worries. No worries.
all right. So Ty, how are we doing with people coming back in from the breakout rooms?
So the breakout rooms are, it looks like they should be completely empty, and everyone that's still on has rejoined us.
Nice. Well, it's good to have everybody back. You know, we hope that that process, you know, it's hard to navigate kind of that process with such a large group. So if it didn't work or if there were tech issues, we sincerely apologize. That can happen, but hopefully, you know, you were able to provide some input or have some discussion with your small group members around these 4 questions. And I know Laura and I are really excited to get a chance to take a look at the Google Doc and see what you've been able to share with us. Okay, so just to wrap up, we just wanted to thank all of you for your participation. I mean, just the chats we were getting throughout really showed that you were actively engaged with us, and I learned so much just from reading through. I'm excited to get the chat transcript and be able to really go through and be able to read all of them. But just really quickly, with a couple of minutes left, we are going to have our contact information on the slides. And as I told one of our participants, I mean it when I say, please do reach out to me. And I think Lauren, I can speak the same for her. You know, we do really genuinely would love for you all to reach out to us with your own experiences, with your, you know, with any additional questions that maybe we weren't able to answer. Because there's a lot, right? We could talk about this in an hour and a half, just does not do it justice. Any of this, right? Doesn't do inclusion justice or any of it, collaboration, right? So if there are additional questions or thoughts, please do reach out to us. Look to see, we've got a couple of chats here.
Verity, will you go ahead and click through to our contact information just in case anyone wants to jot that?
Whoops, here we go. All right, yeah, so please feel free to jot this down. This is just our contact information. You can follow us and like us, not us individually, but Triad. You know, Triad and the Vanderbilt Kennedy Center. Yes, they have. We have active kind of Twitter and Facebook pages. So please check it out. Right, check out our website. And as I mentioned, we'd love to hear from any and all of you. That's all we have. I think we've got, look at that, 2 minutes to spare.
Awesome. Thank you so much. And we're going to have a little bit of an abrupt end because I'm running all the Zoom links. So I have to log this one off to get our next one started. So thank you again for joining us. And hopefully we'll see a lot of you in our next session. Have a good day, everyone.
Thanks, everybody.